Go ahead. All right, you're good to go.
Okay, so this is our the beginning of, our topic, which is the US Department of Health and Human Services, and it's by me, Katie, Lewis, and Courtney. So going on, the mission statement is it is the mission of the U.S. Department of Health and Human Services, which for short is HHS, to enhance and protect the health and well-being of all Americans. We fulfill that mission by providing for effective health and human services and fostering advances in medicine, public health, and social services. So, going on, for the organizational structure, the HHS is a program that accomplishes their mission with a huge variety of activities to serve the American people in every single stage of life. There are 11 divisions, 8 being agencies in the U.S. Public Health Services, and 3 human service agencies that combine the HHS programs. The parts of the organizational chart are the staff division, which provides leadership, direction, and policy management to give and guide the guidance to the department. So after this, we included this chart, which, of course, our source number 2 is the actual site, which is primarily most of the information we got for this is from the site itself, which is hhs.gov. So pretty much the top is the secretary, and under the secretary is the deputy secretary, and then branching off the Office of Intergovernmental Affairs and the Chief of Staff, and then from there, it branches off, and then from those that branch off, it branches off again. So this is a really, really detailed organization, and they have so many different people that come to play. So the principal players, the very top is the secretary, who is Sylvia Matthews Burwell, and she operates under the 3 guiding tenets to deliver results on a wide range of complex issues, to strengthen the relationships that drive progress, and to build strong teams with the talent and focus needed to deliver impact for the American people. So for most of our principal players, it's just the top people that have been branched off, because we're going to go into the operation of divisions later. But the next the person which was mentioned, and I wanted to include him even though he wasn't in the chart, was the Office of Inspector General. And his main mission is to protect the integrity of the Department of Health and Human Services programs, as well as the health and welfare programs of beneficiaries. And then going on, the Director of Intergovernmental and External Affairs is Emily Barson, and she provides advice to the Secretary on the department's work with the governmental and non-governmental stakeholders across the country, and she manages a team over 70 regional Washington, D.C. based HH officials and oversees the department's interactions with state, local, and tribal governments and external partners. The next is the Executive Secretary, Madura Valverde. I'm not exactly sure how to pronounce that, but we actually couldn't directly find her roles. I think that she's just the secretary to the secretary. Then we have the Deputy Secretary, which is right below the original Secretary, Mary Kay Wakefield, and we also could not find direct things that she has done, but we know that she supports the Secretary and the decisions that she makes. So lastly, I'm just going to go over the functions, and what HHS does is they help you know the HIPAA laws and your health rights, insurance, social services, prevention and wellness, providers and facilities, public health and safety, emergency preparedness and response, research, education, and training topics. And their main goal is to protect the health rights of Americans and to allow them to know and to learn about what their rights are. They also help those who can't take care of themselves receive the care that they need, which this could be extended to CMS or, whatever. So then, yeah, you can take this, Katie.
Okay, so some operation divisions. There's a lot of them. But some of them are the National Institutes of Health, the Food and Drug Administration, the Centers for Disease Control and Prevention, or the CDC. And something we kind of wanted to emphasize on the CDC, because it administrates a system of health surveillance to monitor and prevent disease outbreaks. They implement disease prevention strategies, and they maintain national health statistics. They also provide for immunization services and workplace safety and environmental disease prevention. And to go on in the list, there's the Indian Health Service, the Health Resources and Services Administration, and the Substance Abuse and Mental Health Services Administration. And then you also, for a few more of the operating divisions. You have the Administration for Children and Families, the Administration for Community Living, an Agency for Toxic Substance and Disease Registry. You also have the Agency for Healthcare Research and Quality, and lastly, you have the Centers for Medicare and Medicaid Services. And so with their strategic plan, they have a lot on their website about their strategic plan, and so it's really cool to go and see that. But some of the things that they mentioned is it's an agency strategic plan defines its mission, goals, and the means by which it will measure its progress in addressing specific national problems over a 4-year period. And so, like it said there, every 4 years they update their strategic plan to make sure that they're progressing towards the goals that they have set, and if they're not progressing towards them, then they'll maybe take a different action on how to achieve those goals. But their goals are to strengthen healthcare, to advance scientific knowledge and innovation, to advance the health, safety, and well-being of the American people, and to ensure efficiency, transparency, accountability, and effectiveness of HHS programs.
And those are our references. So, yep, that pretty much sums up our little presentation we have for you. So.
Awesome. Well, good job, guys. Or ladies, good job. That was good. Great information. I mean, Health and Human Services is a massive section of the government.
Yeah, that was one thing that we were a little bit, nervous about when we were actually putting it together, was that it's such a big organization that has so many subdivisions that it was really hard to incorporate everything. I mean, because there was 11 different divisions that, they all do different things. I mean, they all strive for the same goal, but, there's just so many different things so many different things for different people that it's really hard to incorporate all the information. So.
Well, I do just have a question for each of you. Really easy. We'll start with you, Lindsay, and then Katie. It'll be the same question. What was something that maybe surprised you in your research, or something that really stood out to you that you didn't know before, or something that maybe surprised you that you didn't know?
I mean, for me personally, I was surprised that all of this was under technically one organization. That is what really surprised me the most, because, I mean, I've always known what CMS was. I know what CDC was. And FDA. I've known about all of that, and I know that they've all had similar goals to, protect the American people and to serve them. But automatically, I did not know that they were all run by the same department. I have actually never heard of the Health and Human Services organization before this project. So pretty much what impressed me was that it was all under the the overview of one complete organization. So that's what impressed me the most when I was doing this project.
Great. Katie?
I think for me, something that just really stood out to me with this organization, I think, is how involved they are with the people, and to help improve people's health, to provide them opportunities to manage their health, and to make it better. So I just thought it was very interesting to learn all their many goals that they have to succeed in that. And how if they're not reaching their goals, I was really surprised by how they'll reevaluate them and every 4 years and retry or keep working towards those goals to improve them. So I thought that was really cool, especially with their goals that they have.
Great. Thank you both. I'm going to go ahead and stop the broadcast, but hang on here for just a second.